Hi, I'm Gene Bruno. I'm the Dean of Academics for Huntington College of Health Sciences, and I'm here today at Phoenix Laboratories in their Quality Control Lab as a guest to talk to you about herbal relief for pain and inflammation. Let's begin by talking about how pain works in the body. First of all, there are two enzymes known as cyclooxygenase 1 and 2, or COX-1 and 2 for short. And these enzymes have some important roles in how pain progresses. COX-1 is an enzyme involved in housekeeping. It has many important functions, and you don't really want to stop it from working. COX-2 is an enzyme that's involved in inflammatory response. So, for example, if you get into an accident or you have an injury, your body is going to create inflammation, which helps bring blood to the area and helps increase healing. The problem is, when you don't have an injury like that, you really don't want a lot of inflammation going on. And when that COX-2 enzyme is active, you might get long-term inflammation. That's the kind of thing that happens when you have arthritis. Also, the COX-2 enzyme is very active in other kinds of diseases, such as cardiovascular disease. And again, the more inflammation you have going on then, the more problems you get. So, ideally, if you can block some of that COX-2 enzyme activity, you're going to have some relief from pain and inflammation. How can we do that? Well, I'm sure you've heard, probably in the news, about various drugs that are COX-2 inhibitors. There are also some herbal supplements that are natural COX-2 inhibitors. Some of them are even LOX inhibitors, LOX, that's another kind of pain chemical in your body. But in any case, they're very effective at helping to block that inflammatory and pain response. I want to talk to you first about turmeric. Now, you may be familiar with turmeric. It's a bright yellow spice, been around for a very long time, very popular in East Indian cooking. But it also has a medicinal quality. It contains some compounds known as curcuminoids. And these curcuminoids have had extensive research. They've been found to be both COX inhibitors and LOX inhibitors. So it's kind of a double whammy in terms of helping to reduce inflammation. There's been some very good research on it, particularly in the case of arthritis, showing it to be not only effective in reducing the pain and inflammation associated with arthritis, but actually as effective or even more effective than different types of drugs, including cortisone. Now I want to talk to you about bromelain. Bromelain is an enzyme from pineapples, and it's not actually a COX-2 inhibitor, but nevertheless it has some very good anti-inflammatory properties. It has anti-inflammatory properties in minor types of injuries, as well as things like back pain and fractures and minor surgery. Research has shown it to be effective in helping to reduce inflammation and edema resulting from surgery. Edema is, water retention. And there's even research showing it to be effective for thrombophlebitis, which is basically just inflammation of the veins. You find that in the legs sometimes. Overall, bromelain is an extremely effective natural anti-inflammatory agent. Ginger is one of my favorite culinary herbs. It tastes especially good with sushi, but ginger is also an anti-inflammatory herb. It's probably better known for its anti-nausea properties. If you have, for example, car sickness or air sickness, it's very good for that. But its anti-inflammatory properties have been recognized, and historically it's been used for arthritis and rheumatism. There have been a number of studies showing it to be effective for arthritis, some going on as long as 2.5 years and still seeing effectiveness during that time frame. Osteoarthritis, particularly of the hips and knees, were really responsive to ginger. It seems to exert its activity by both a COX-2 inhibiting property as well as a LOX inhibiting property. Boswellia is an Ayurvedic herb. That is an herb used in East Indian medicine. And rheumatoid arthritis, osteoarthritis, and inflammation of the vertebrae have all been found to be responsive to the use of Boswellia. Specifically, it's the boswellic acids inside of the Boswellia that have the effect. They inhibit another pain-related chemical called leukotrienes. As a matter of fact, leukotrienes are a chemical that is inhibited by some of the pharmaceutical drugs. Corticosteroids have a similar effect. The problem is corticosteroids have a range of side effects, and boswellic acid has no significant side effects or toxicity. So it's a particularly nice one to use. The next herbal component I want to talk to you about is salicin. Now, salicin is a component found in white willow bark. And it's kind of interesting, the history of it, because it was from white willow bark that the Bayer company originally synthesized aspirin. You see, white willow bark contains salicin. Salicin in the body is converted into salicylic acid. And then if you add chemically an acetyl group to it, you get acetyl salicylic acid, or aspirin. In any case, good old-fashioned white willow bark, or specifically the salicin that comes from it, has been shown to be very effective in the treatment of different types of inflammatory disorders. It is, like aspirin, a COX-2 inhibitor, and it has those properties. But unlike aspirin, it does not act as an anticoagulant. So in other words, it's not going to function really as a blood thinner. You don't really have to worry about it from that perspective. It's been shown to be effective in the treatment of osteoarthritis of the hips and of the knees. And it's even been shown to be effective in the treatment of low back pain, which is often very difficult to treat. But in any case, salicin is a premium anti-inflammatory. Now, if I say hops, you probably think of an herb that is used in beer. But hops has other properties. It has something in it called alpha acids, and they have very effective COX-2 inhibiting properties. As a matter of fact, in research, the COX-2 inhibiting properties lasted over 9 hours, which was equivalent to taking about 400 milligrams of ibuprofen. The other part to this that was nice is that, unlike its pharmaceutical counterparts, it had very little COX-1 inhibition. Remember, COX-1 is important for housekeeping in the body, so as a result, it didn't have the tendency to have gastric or stomach problems that you might have gotten otherwise. In research, it's been shown to be effective in the treatment of osteoarthritis. As a matter of fact, subjects who used this particular herb in combination with some other herbs had a 50% reduction in pain in osteoarthritis. So again, another wonderful herb for this purpose. Now, if you're interested in what I've talked about today and you'd like to read an article about it, I've written one called Herbal COX-2 Inhibitors, a Natural Alternative, which you can download for free from greatearth.com. Just go to the educational literature link and click on it, and from there you can access that. Thank you.